listening to Flor Unmuted. I'm Flor, and every week we're talking power, politics, cultura, and the people getting left behind. Let's get into it. Before we jump into today's conversation, I want to share a little context. One of the goals of Flor Unmuted has always been to create a space for longer conversations with the people asking for your vote. Not just sound bites or campaign ads, but thoughtful discussions about how they think, how they lead, and how they would govern. Today's guest is Sandra Van Scotter, Democratic candidate for California's 20th Congressional District. What interested me most about this conversation wasn't simply her policy positions, it was her campaign philosophies. Sandra has made the unusual decision not to seek political endorsements, saying she doesn't want to be beholden to organizations or special interests. That raises some interesting questions. What does political independence really look like? How do candidates build trust with voters? And once elected, how do they balance independence with the relationships and coalition building that governing requires? We're hearing a lot of this messaging. These are some of the questions that we explore in this episode, along with healthcare, immigration, Social Security, and the unique challenges facing the Central Valley. As always, my goal isn't to tell you what to think. It's to help you better understand the people who want to represent our communities so you can make an informed decision for yourself. Here's my conversation with Sandra Van Scotter. Thank you for joining me on Flor Unmuted. I'm so honored to have this time with you and talk about your campaign, who you are, and why you're running.
So I'm Sandra Van Scotter, and I'm a Chicago girl. I was born in Chicago, grew up in the suburbs, and moved here to California in 2014. I went to college to be a respiratory therapist, and I worked in several hospitals in Illinois, and it's finishing up at Northwestern. Before I moved here to California. And you know, before I did that, I come from a huge working class family. I'm one of 8 siblings. My dad is a member of Teamsters, and my stepmom, she was Carol in accounting, you know, with Teamsters. And so we all learned how to take care of ourselves, had good work ethic. And it was in school. My early education was in Chicago public schools, which at the time in the 1970s, they were not a good school district. And so I got to help kids that needed tutoring with learning how to read and stuff like that. And that was my first kind of like taste of advocacy and helping people. And, you know, we both got a lot out of it. And so I've always been driven to service. And when I moved here to California, I learned about the regional center system. My middle child, my older son, he's autistic, and there were no services in Illinois where we lived. We live pretty rural, about 5 hours south of Chicago, and so no services. So when I came here and I was hearing other families talking about regional center, I was like, oh, this is a very interesting thing. But we were able to get my son's services, you know, met through school with his individual education plan. And I didn't really get involved in the regional center system until my son graduated from high school, and he needed more support than I could provide for him on my own. So that was my introduction into what I do now.
See.
I'm one of those parents when a child has a need, I fully immerse myself into learning all about that need, and you know, all the resources. Kind of feeds into being a respiratory therapist. I like to know a lot about one thing.
Mm-hmm.
So that kind of
interesting
into what made me decide to run is the work I do now with intellectually and developmentally disabled adults. I help them maintain their independence. When that bill was passed last year, now they're calling it the Working Families Tax Relief Act instead of the One Big Beautiful Bill. But when that was passed last year, the people I already serve were blowing up my phone. Oh my goodness, we're going to lose our benefits. We're going to be homeless. They were really scared. Yet I knew that they had let me help them lay the foundation to be able to maintain their benefits with ABLE account, which is a nationwide program to allow people who receive disability or other means tested services to save more money than the $2,000, the $2,000 asset limit. And so I knew that if I could help a few people, I could help a lot of people. And that was initially why I decided to run, because I believed the pie chart that, this almost 50% registered Republican, only 25% registered Democrat. The pie chart, the other 25% is minor parties and no party preference. But then as I started going around and talking to people, I realized that there was a path to win. And so this has been a trajectory of, growing into, we're not just running to help people, we're running to win this election.
Yeah, absolutely. And you have tremendous firsthand experience navigating healthcare, both as a mom and somebody, working in the industry. Congress, though, and this is something that your opponent, Vince Fong, campaigns on. It's about legislating, negotiating, and building coalitions. How do you convince voters that lived experience prepares you for those responsibilities as well?
You're talking with them by demonstrating that I've been able to do that in the work that I do. The committee that I serve on now for the Kern Regional Center, it's the Self-Determination Program, a local advisory committee. We definitely guide the regional center system with how to deliver services. I manage my my clients' budgets. It's like half million dollar budget for 4 people is a budget. I rely back on my policy making in healthcare, and really the feedback that I get from people as I'm campaigning is, Vince Fong has, been able to build those coalitions, but he hasn't been able to demonstrate that he understands what the people living in this congressional district are experiencing. And so they at this point, the feedback that I'm getting is this other stuff isn't done in a vacuum. Legislating is not done in a vacuum. You're doing it as a whole house.
Mm-hmm.
The lived experience and the people skills and the understanding what other people's lived experiences and can relate to them are, that's just something that comes with living. And our congressional district and this geographic space have been not paid attention to for a really, really long time. And so people aren't, there are some people that are like, why didn't you run for a more local office? Because I didn't feel like what I can bring to the table would be best utilized in a local office setting.
Yeah. And you touched on this here a little bit in your introduction in terms of the makeup of Congressional District 20. And, in the June primary, you received 29% of the vote, of the votership in that primary. And, that's not insignificant. I think there were 4 people on the ballot and you were in the top 2. One of the things by looking at those numbers, that kind of tells us, that you might have to persuade moderate, independents, no party preference voters, Republicans even, and maybe even some lower propensity voters that probably have become a little disillusioned with the voting system. And I guess my question is what is your plan to consolidate those votes in your favor?
The plan is to continue showing up. I've put well over 30,000 miles on my car now, showing up in person and door knocking and phone calling. And, that's what I've been doing a lot the last month or so, is calling people just to introduce myself, because I know that I'm not going to be able to meet everybody in person. We have people postcarding already. And we are fully aware of the burnout that people are experiencing with our almost continuous election cycle. And so we're pretty sensitive to that we don't want to be all like in people's faces, but we definitely don't want people to forget that there's an election coming in November. So with the timing of, let's not fully disappear, but let's give people a little bit of a break. Come the end of August, early September, it's just going to be continuous nonstop, making sure we're contacting as many people as we can and as many avenues as we can to, of course, get them to come out and vote for me, but to get them to come out and vote at all. People have been very disillusioned and disenfranchised in our congressional district because even before Prop 50, we were pretty safely Republican for, whoever was running in that seat. And so a lot of Democrats just feel like my vote doesn't matter. And that's the consequence of gerrymandering. And so getting people to come out and, speak up and the only way you can tell your government that you want change is if you come out and vote.
Mm-hmm. Yeah. And I want to switch up here to endorsements. Have you received any particular endorsements from any coalitions or organizations?
There have been a few unsolicited endorsements from like progressive groups encouraging people to vote for me. There are some Democratic clubs now that we're through the primary. They're allowed to give endorsement because of the makeup of the congressional district, and in talking to people about how do you decide who to vote for? Well, you look at who they're endorsed by. Well, what do you do if you don't like who endorsed the candidate? Well, then I don't vote for the candidate. And I hear that pretty consistently over and over again. And because of the votes that I need to, the people that I need to have vote for me, who would probably not vote for me if I was endorsed by somebody or an organization that they don't agree with or is very polar opposite of how they might be registered to vote. In my strategy, the endorsements are more of a handicap. The other thing that my mindset about endorsements is, what makes people so angry about money in politics is if you're taking money from somebody, you're held to upholding their agenda, whatever it is. There's no money in politics without strings attached. And I didn't want to play that either. So I have chosen a very difficult path of fully individual donations. And when I have this conversation with people, they totally resonate with it and they understand that doesn't necessarily mean that they are able to donate, but they understand that, when I'm elected and even in my process of campaigning, I'm only accountable to them and not to anybody who's given me, a big endorsement. And then we see what happened, even out east in Maine. This is pretty fresh as of this recording, that, Mr. Plattner would not have been able to stay on the ticket because the endorsements he received had been pulled, which means the money was also pulled. So, it's made pretty clear that, that money had strings attached.
Are you, I guess, many voters view endorsements as a signal that a candidate has earned, trust from organizations or, leaders who have worked on issues for years. Because organizations really at the end of the day are a collection of people. For example, you've got like a nurses association, veterans organizations, farm bureaus, even disability rights groups, teachers associations. These sorts of organizations, they're not just institutions, they're communities of constituents. So my question is without endorsements, what should voters look to as evidence that you're prepared to be effective or that you're doing everything you can to reach them?
First thing that comes to my mind is basically faith in that, I'm acknowledging what they're angry about, money in politics. I'm acknowledging that they feel powerless with the money in politics. And no matter what has come my way or not come my way as far as donations, that I'm continuing to run to represent them. And because, honestly, let's look at, just historically, candidates who have been endorsed by people who, really wound up, we found out, different things about them, the endorsement process is part of how we got here as a country. And if we're going to do different and be different and actually represent the people, we need to start shifting away from that.
And a follow-up question to that, if elected, in Congress, there's a lot of caucusing that you have to do. You have to build support. You have to talk to your allies and sometimes work across the aisle to garner votership, to pass legislation or accomplish, the very initiatives that you campaign on. What is your plan, or how do you build those relationships in Congress while also remaining independent, keeping money out of the equation, right? In those situations, it's more of a relationship building, right? But I guess in politics, that is also transactional, regardless if it
Yes.
involves money. So what's your
Yes.
plan there to accomplish your platform if elected?
So my plan there is to do what I've done previously. My whole career as a respiratory therapist. In most hospitals, the respiratory therapy department is pretty small compared to the amount of work that they do, and to gain the trust and respect of the professionals around you, the doctors, the nurses, everyone else, is you have to cross the aisle. You must. Otherwise, you can't do your job. And crossing the aisle and finding a common goal and understanding what each other's needs are and working together to become individually better legislators and work better together to serve the people that have elected to serve you. That's what my whole life and career has been, is working with others, crossing the aisle to get the end result that the people who elected us into the space want to see.
Yeah. Now, I want to switch up here and talk about healthcare and policy, which you already pretty much touched on in terms of the big, beautiful bill. So I want to ask you, if you could realistically accomplish one healthcare reform during your first term, what would it be and why?
So what I think we can realistically do is to stop implementation of the one big beautiful bill. That is what I believe we can realistically do with a majority in the House. I don't think we will get cooperation from the administration if we don't have a majority in the Senate. That's realistically what we're going to be able to do in the first term. And it's pretty urgent that we do that. We are already seeing layoffs across 2 hospital systems in Kern County. As I said earlier, people's access to services through Medi-Cal are being reduced. And starting in September, 3 of the 4 counties, some people will also lose their CalFresh if they're not able to keep up with the work requirements, which disproportionately affect our seasonal workers, our farm workers. Our farm workers. Of course, if they're not appropriately documented, they don't have access to those services. And I believe the state will step up like they did in November and help those families out through CAP-K and other programs to make sure that people still have access to food. But yeah, we're going to start feeling collectively the pain pretty quickly.
And looking ahead, campaigns often ask voters to believe in hope. And in your district, I think, that's a huge piece of what we're seeing today politically.
Mhm.
What's one promise that you're intentionally not making to voters because you believe it's actually unrealistic?
I am intentionally not making promises about single payer healthcare. I don't think it's fair to make a promise about something that I know, like I just said, we don't have cooperation from the administration and may not have enough of a majority in the Senate, if we have one at all, to make anything like that move. So what I do promise them, though, is to use the tools we already have. We already have money that's been appropriated that hasn't been spent yet. We can guide how that is spent to support the people in our congressional districts. I have the ability to promise them that I will be present, that if you call my office, somebody's going to answer the phone. I am already recruiting caseworkers for Veterans Administration and Social Security to help people navigate those systems when they contact our office. If I'm elected, there will definitely be a link on my website to start that process, which right now our current representative does not have on his website. And if I don't win in November, I'm campaigning for 2028, and we will make sure that we are available in the community to do those things. And we're setting up to be able to help people access Veterans Administration benefits if they have come to a standstill on their own, and building relationships with the VA and making sure we can, get people to appropriate help with Social Security if they need to make appeals or various other things that's probably one of the biggest questions, or the subject matter of questions that I answer when I'm out and about, is how do I access this? How do I do that? Who do I contact? And because, people need help, and they've gone to all the avenues that they know they can look, and they still haven't gotten the relief they needed. And that's really going to be what we need over the next couple of years, is somebody who's going to, I hear you, I understand you, this is what I know how to do, let's do this together. It's going to be a little bit more difficult if I'm not elected, and I'm definitely the office will have more pull when we are elected.
Mm-hmm.
Because that's really what people need now.
Yeah. And in terms of your opponent, Vince Vaughn, have you heard his platform on healthcare for the constituents of CD20? And if so, how do you agree or disagree with the way that with his approach?
What I understand his approach is, he does not think that the Working Families Tax Relief Act, or the One Big Beautiful Bill, is going to have the impact that we're already seeing. He did come out with Dr. Oz out to Kern Memorial when they were quite in a crisis, and they were able to pull together some funding to help them stay afloat. But they're also one of the hospitals that's doing some major layoffs right now. So I don't think he actually understood the human impact of the bill he voted for. Like I said, there were some good things that came out of the bill. For example, with the Able Account program, one of the features of it that was supposed to sunset is now permanent. So I think that was an accidental good thing. I think if they knew that it was a good thing, I'm not sure it would have survived staying in the bill. But yeah, I honestly, my brain is struggling to understand how people with children made choices to vote for that bill.
Mm-hmm. Mm-hmm. Yeah. And the news broke on these hospital closures and employees going on layoffs. I think there was a report from EDD that came out about potential number of employees that wouldn't be employed in the healthcare field specifically. Have you heard from your Congress member on comments about the result of that, or has there been any commentary from their office that you...
Not that I've seen, which kind of matches what we saw when the bill was passed. So as I think I said in the beginning, nobody from either party came to explain to the people what happened last year when the bill was passed and signed. And I guess there was this expectation in my brain that they should have. So, and that expectation was set back when I was a junior in high school. Our member of the House came to our high school, talked to the junior class, because we were all taking U.S. history, and talked to us about, what a member of the House does. But one of the things I will never, ever forget is he said, don't count on Social Security for your retirement, because it won't be there for you. And that was 40 years ago. And so I was like, at first I thought, like, wow, I'm never going to forget that he said that, because it was such a huge thing. Like at 16, none of us knew what Social Security was. None of our grandparents really were at retirement age. It was just this term kind of thing. But now that I'm going through the congressional district and talking to a bunch of people, I have talked to a lot of people in my age group that also had that same experience with their representative coming to their school and talking to them. And we're not seeing that so much now, where the representative is coming to them and giving them information, even if it's news that the people don't want to hear. Mm-hmm. That it's a big change. So when I didn't see the representatives, $1 trillion, there's no way you can make $1 trillion cut painless.
Yeah. And for the listeners who are not familiar with that conversation of, Social Security going away and things of that nature, can you tell me, just from your perspective, maybe like 2 things that this administration and the House is currently doing to impact the ability for us to access our healthcare benefit, our Social Security benefits?
Yes. So what's going to happen toward the end of 2032 is there's going to be a 22-ish% reduction in payments to people receiving Social Security retirement. So there's Social Security disability, and then there's Social Security retirement. And those are 2 completely different buckets. So for for years and years, I think a lot of us have, been paying attention to. We knew that this was going to come at some point because there aren't enough people currently working to keep the fund fully funded, but we thought it was going to come later, like closer to 2040. The office that made this announcement, I'm going to say last month, even in June, explained that the reason why we're going to see that cut is part of the reason why is people who are immigrants who have been paying taxes into the system, into a system that they were never going to be able to use the benefits of that system, receive retirement or Medicare when they hit 65. The mass deportation of that particular population brought the cuts much sooner. And the other thing that there has been no political will to do is raise what's called the employment tax. Right now, you're with your employer, my employer, I pay 6.25% tax. My employer pays 6.25% employment tax, and that goes into the Social Security bucket. All of us also pay what's called a Medicare tax. And that Medicare tax pays for the ability to access Medicare for people who are already receiving benefits from Medicare. So that keeps that program solvent, is the word that they use. That reduction in Social Security by 22% is going to hit us much sooner. And like I said, right now there's no political will to resolve that.
I want to ask you a follow-up to that. I think, or maybe it's just a comment, but there are a lot of benefits to Social Security. Like I think people hear Social Security and you hear like, oh, when I retire, when I'm like 60, and but you talk about Social Security disability, right? And so I think it also involves youth and minor children who lose their parents, right?
Yes.
So it could be our nephew, it could be our cousin, it could be anybody that we know that would be directly impacted that, likely we would have to take in and support a minor child in our family who lost their parents. And so it's kind of like as a working family or a working constituent, right? It's kind of like, what do you mean that all of this money that their parents paid into is now like not available, right? Raising the retirement age is also a way to kind of maneuver that, because if you can't access your benefits until you're older, then that also means that you're receiving the benefits closer to when you die. So they're not paying it out, as quickly. Which brings me to my next point. And I'm gonna tie the gubernatorial endorsement of Steve Hilton by Donald Trump. It didn't move the needle for Steve Hilton at the last campaign for Vince Fong. Donald Trump actually endorsed Vince Fong in that election. Have you heard of whether or not your opponent has accepted an endorsement from Donald Trump? And if not, is that something your campaign is going to be tracking? Not that it'll make a difference.
So Donald Trump did endorse Vince Fong for this election cycle.
Okay.
And Vince Fong wholeheartedly embraced the endorsement. I'm not sure that it made, like the term you use, move the needle for him, that he was going to receive any more votes than he was going to get already, kind of thing. The very loyal base, they were going to vote for Vince regardless. And so, that is what it is. I am very intentionally not pointing these things out. When I do point things out about, what Representative Fong talks about, for example, when he was like talking about the Cal Repayment Act, and he thought it was going to be this, how it was described was it was going to be a relief to small business owners and various other things because of the money that was loaned to the state to pay for people's unemployment while they were off of work during COVID. So the state owes the government, $21 billion that they've only made interest payments on, and maybe like a single $225 million payment on the principal. But what the Cal repayment really does is if California gets any federal like disaster relief funding or funding that they have, federal funding that they kind of have a choice in how to spend it within the category, they actually have to use that funding to pay back the government the $21 billion dollars first. And so we wouldn't be able to get people relief from yet another fire. If we got that kind of money from the government, we'd have to use that money to pay back the $21 billion dollars from COVID, from unemployment. And so it really doesn't help anybody. And so how it's being touted, the other, so I respond to that and I'm like, no, this is what it really does. And this is what the mechanisms are, and this is who benefits from it. And I make sure to point that out in everything that I have a rebuttal for. Same thing with the those $1,000 Trump baby accounts. And, they're being touted as, oh, when your kid's 18, they can use it to go to school and all that, but they cannot. The type of account it becomes when the beneficiary turns 18 is a traditional IRA. So if they try to cash it out, they're going to have the taxes and penalties, and it's not going to be worth nearly what they thought it might be on paper. And I try to be accurate in what's going on versus trying to, no, he's wrong. You know what I mean? I really want to stay away from the rhetoric. I really want to stay away from, just the quick snippets of inflammatory. I really want to keep the flame down and help people make informed choices about how to proceed.
I see. And, you know your votership and your district and, your strategy. For your campaign, you're the one on the ground and talking to voters. I do have a question on that. With what we're seeing on a national scale with Democrats overwhelmingly turning out to vote, your campaign isn't accepting endorsements to avoid these factions of being, technically like beholden to certain priorities and not others, and, persuading voters this way or that way. It's been said that some voters are voting for these progressive candidates because they seem to know where they stand on certain topics. So for now, where does your platform land on immigration?
So we'll start with immigration. So I'm old enough to remember before 9/11 and when we had the Immigration and Naturalization Services. And it was an agency that talked to all of the moving parts of the agency. It was definitely immigration enforcement. I remember I had just started working in the restaurant industry. My experience with my coworkers was a lot of them have the same fears that our immigrant neighbors do now, that, they could, be picked up and deported anytime. Program. Almost 2 million people took advantage of the amnesty program as a path to citizenship. And my coworkers were pretty split. Some of them were just like, yeah, I'm going to go through the process. And some of them like, no, it's a trap. It's a trap to capture us and deport us and send us out. So the unfortunate thing about how the United States handles immigration, all of those, they're siloed and they don't communicate with each other, or at least don't seem to. It seems like the structure now is really meant to intimidate, bully, scare people, and it's working. Unfortunately, I would like to see that whole structure go back to what we had before, a one agency. I would like to see sanctuary cities and sanctuary states be hubs of immigration to that extent. But I don't think the inhumane way of what our current administration is utilizing the ICE for, I don't think it was ever intended to be used this way. The other thing attached to that is this whole birthright citizenship thing that just got decided again by the Supreme Court. I believe this is the third time in its history, if not the fourth, that the Supreme Court has looked at it. A lot of babies who are born here are deported with their parents, even though they're citizens, and they're deported without proper documentation. So I would be very much an advocate for making sure that these United States citizens that are born here to parents that are not citizens have at least an appropriate birth certificate that can be taken with them if they're deported to their parents' country of origin, so that they can receive services in the parents' country of origin. Because right now there's hundreds of thousands of babies that have been deported over the last few years that are living in their parents' country of origin that can't go to school, that can't receive medical care because they don't have any identification documentation to allow them to be brought into their parents' country of origin's social system. So that would be something that I would advocate pretty strongly for. And I realize that is a state level thing that's handled through the counties and through the Secretary of State to get the appropriate, I'm not sure I'm pronouncing it right.
Do you think that we're still upholding a pathway to citizenship? We just saw the some local detention centers that were privately owned have sold to the federal government. One of the biggest issues with having these detention centers in these local areas, rural communities, the makeup of Kern County, is that they do take up a lot of different services, like emergency services, hospital services, things of that nature. If you are elected to Congress, what is your plan for these contracts that they just acquired?
So my understanding is 2 facilities were sold to the federal government by CoreCivic, including one in California City, which is in Kern County. And CoreCivic still maintains the contract of providing the services in these detention facilities. I think, honestly, there's a process that's broken somewhere in the middle where the federal government doesn't feel like they have responsibility to maintain humane conditions in the facilities, and neither does the county. So as a person, like in my role as a representative of the, on the federal level, I think the first thing to do is figure out where the break is and how did it happen and how do we repair it on the federal level, and to have the county, do its due diligence about, the Kern County Board of Supervisors. A lot of their argument was there's other agencies that are supposed to be doing this that the people are asking us to do. So they don't want to overlap services, but at the same time, the other services that they don't want to overlap also are not happening. From the inside the facilities, I don't know how we're taking up services like ambulance service and stuff like that because people are reporting they're not getting medical care. So I'm not sure where, which, if I'm going to believe reports, I'm going to believe the reports from the people inside the facilities before I believe, there's so much more ambulance calls than there ever were before. But I don't think we're seeing that. I don't believe that the federal government belongs anywhere in women's right to choose with healthcare and access to healthcare. In my experience in the healthcare system, ranging from, just Planned Parenthood, this is all observation, Planned Parenthood, going in to get birth control pills and, a Plan B pill, to hospital care and reproductive care. There's no decision is made without lots of consideration and thought. No. I really don't think anybody walks into a reproductive health situation and says, oh, it's whatevs. And I really don't think that the government has any space in the relationship between the doctor and the patient. So I believe that, whatever regulation there is on the medical side, of course, for example, we definitely have to regulate and govern and make sure that facilities are appropriately, licensed in various things to provide various services. Religious-based hospital systems definitely have their freedom of religion to provide certain services, but people don't have to go there for those services. But beyond that, if, something's going on where, you and your doctor decide that this is a certain path to take, that should be between the patient and their doctor, the woman and their doctor, and the government should not be involved. Same with LGBTQ rights and gender affirming care. I also believe that the rhetoric that we're being fed is all gender affirming care is give them drugs and do surgery, and nothing can be further from the truth. Gender affirming care for minors starts with talk therapy, starts with supporting the parents and the families as the person figures out who they are. Any other type of medication or surgery is definitely, those decisions are definitely made after the person is an adult. The concern about gender affirming care for minors is that there are definitely legitimate medical reasons for minors to be administered hormone therapy for what's usually expected to be the opposite gender. And so those minors aren't also aren't able to get the therapy and the care that they need because of the fear of being defunded because gender affirming care was provided to a minor. And so I also think that the government and especially the Centers for Medicare and Medicaid Services need to trust that the guidelines that were given to the doctors in those environments are being followed, and the funding shouldn't be cut because it looks like gender affirming care. I think it's absolutely horrible. One of the things that I think a lot of people don't realize is that our LGBTQ community virtually encompasses every single other community. So when we're infringing on LGBTQ rights, we are quite literally infringing on everyone's rights. And so, we need to look at what the Constitution says and follow the Constitution regardless of how you personally feel about things. The rhetoric about, LGBTQ being people like choosing that lifestyle and people assuming that gender identity is equal to sexual preference is absolutely wrong and inflammatory. And when you have that in the space, there's no discussing around it. They're firmly in their position and they're firmly in their position. And I think the role of government in the middle is to protect our human rights.
Interesting. Thank you, Sandra. What's your stance on how private companies might take advantage of the system and increase things like healthcare costs?
So when I worked in a hospital, there was a lot of training that we did to make sure that we weren't overbilling and we were only billing for what we actually did and we were only billing for the equipment that we used and all of this stuff. This fraud that we see is happening above the employee level. And there's a whole undercurrent sub industry of selling data that has people's Medicaid and Medicare numbers that these doctors and clinics and, these people committing all of this fraud utilize to get away with what they can in making as much money as they can before they get caught. They know they're going to get caught because of how the Medicare system especially works. And there does probably need to be a shifting more from trust and verify, which is kind of how Medicare functions now. And then they look for patterns of fraud before they, which basically patterns of fraud is this person making more money than their practice could actually allow them to see this many people or write this many prescriptions kind of thing. They've tried to put a little bit of a crunch on that by minimizing like being able to order stuff over the phone from the doctor that they have on staff. So they've tried to minimize some of that. So the two types of fraud are completely separate. On the Medicaid side, the big sources of fraud are delivery systems for disabled people. And this is where we're running into stuff with our own Department of Developmental Services and the regional center system and the centers of CMS. I'll just abbreviate it. There's two M's in there, but CMS, looking at applied behavioral analysis therapy, ABA therapy for autistic people. A lot of those agencies, not necessarily working through our regional center system, but a lot of those agencies that have contracts with Medi-Cal are billing ridiculous amounts of money for the service and definitely more than the market average is. And they take advantage of how the checks and balances are performed to make as much money as they can before they're caught. So those third-party organizations, I know like for all the counties in California, we all have our managed Medi-Cal, which has been around in most of the country since 2014, moving from straight Medicaid or Medi-Cal to a managed Medi-Cal system to try and control how much money is spent. And the referral system from a primary does help reduce some testing that may not be medically necessary, but it also creates more of a barrier to accessing care. So finding the balance of how do we do both and how do we catch fraud and patterns of fraud before somebody is walking away with hundreds of billions of dollars or millions of dollars anyway, that's hard to recoup. So So, but yeah, I'll go back to with the CalFresh and Medi-Cal. If you truly believe that somebody you know is not eligible, call the fraud hotline. It's, let the process, let due process happen instead of walking around saying, oh, they should have had that, kind of thing. Because
Yeah.
you know what? When you go through that process and you present, this is how much money I made, I haven't worked in this long, here in California, we definitely have a way to electronically verify that.
Sandra, thank you so much for answering my questions. Anything that you want to tell your voters and our listeners that they probably can't find on your website or can, but you want to highlight anyway?
So the first thing I want people to know is I am running to represent everyone. The people's needs will always come first. I promise to show up, and that's the most important thing that I can do. My website is elect Sandra Van Scotter, SandraVanscotter.com, electsandravanscotter.com. I'm on all the socials, Instagram, Facebook, Threads. Threads is an amazing place, by the way, if you haven't been there. TikTok, we're experimenting with TikTok. I have a Substack, and that's where a lot of my long form stuff is. I've been told that my stuff about my positions on women's rights and various things haven't made it to my website yet, and they should very quickly. I don't want to be doom and gloom, but it's really, really important that at least the House gets flipped in November so that we can kind of put a pause on the crazy and figure out how to take care of people and navigate the rest of what's coming. And hopefully we can at least put a stop to the implementation of that almost $1 trillion in cuts.